Did you know that we spend about 90% of our time indoors? So why aren't we talking about indoor air quality, especially when COVID is still spreading and people are being encouraged to return to offices? Let me explain. We know that SARS-CoV-2, the virus that causes COVID, is transmitted by airborne droplets called aerosols that hang in the air and can travel over short and long distances. And besides reducing COVID transmission rates, we know that fresh air is really important for health in general. Florence Nightingale, for example, once highlighted the importance of bedroom ventilation for tuberculosis patients. And Nordic parents often let their babies nap outside in the freezing cold. SARS-CoV-2 isn't the only virus that spreads through the air indoors. Influenza and other respiratory viruses also spread this way. Studies have shown that poor ventilation leads to cognitive impairment and sick building syndrome. So why aren't we prioritizing clean indoor air the same way we prioritize, say, clean drinking water? Is there actually anyone regulating our indoor air quality? It turns out there is. That would be ASHRAE, a US industry body that sets standards for what it calls acceptable indoor air quality. ASHRAE standards aim to limit exposure to harmful substances with known exposure limits, such as formaldehyde, but not to pathogens. And here's the problem. According to experts, those air quality standards are far below what is needed to stop the spread of COVID. That's because minimum ventilation rates don't totally stop the spread of airborne pathogens, and many buildings don't even meet those standards. Changing these standards takes time, but we're going to break down the components of improving indoor air quality and exactly what you need to do. Number 1. Source control. In 1858, chemist Max von Pettenkofer, one of the pioneers of the indoor air quality movement, said that if space contains a pile of manure, one should not try to remove the odor by ventilation, but rather remove the manure. For example, one could remove cooking gas fumes by using an electric stove instead of a gas one. So if you want to limit the amount of SARS-CoV-2 particles in the air, you could theoretically mandate that people wear high-quality masks and ensure that anyone who feels sick stays home instead of coming into the office. Of course, such measures alone cannot prevent all pathogens or other pollutants from entering the air, which is why other steps are needed. Number 2. Ventilation. A building's ventilation level refers to how much fresh outdoor air is being brought in. This fresh air dilutes the concentration of virus-laden particles in the air. Imagine a SARS-CoV-2 particle indoors as a drop of food coloring in a cup of water. Outdoors, it's more like a drop of dye in the ocean. It rapidly becomes so diluted that it's largely undetectable. Ventilation makes the indoor cup a lot more like the outdoor ocean. The simplest and cheapest option is to open a window, but that's not always viable, especially if the air outside is more polluted than that inside. Experts say this can become a major equity issue. People of color, for example, are more likely to live and work in areas where they're exposed to harmful pollution. Aside from windows, another source of indoor ventilation is an HVAC system. Most of these systems allow a building manager to vary the amount of fresh air intake. It should generally be set to maximum, experts say, provided the outdoor air quality is safe. Yet before the pandemic, many buildings had their HVAC systems set to recirculate old, stale air. A good rule of thumb is to aim for having at least 6 air exchanges per hour through ventilation, or the equivalent amount of fresh air through filtration. One way we can indirectly measure the amount of ventilation in the space is by using a carbon dioxide monitor. Humans exhale carbon dioxide when we breathe, so levels of this gas provide a good proxy for how diluted the air is. Values below about 800 parts per million are potentially well ventilated. Number 3. Filtration. Filtration basically just means removing particles and other pollutants from the air. A standard called MERV offers a way of comparing different filters. The gold standard filter, HEPA, can remove 99.97% of airborne particles that are 0.3 micron in size, and an even greater percentage of larger or smaller particles. HEPA is equivalent to a rating of MERV 17 or higher. A best practice is to upgrade filters to at least MERV 13 for most indoor settings. Many HVAC systems can be upgraded to this standard, but some older ones may have trouble with high-efficiency filters and may cause air to leak around the filters. You can also buy a freestanding device called a portable air cleaner, but these devices aren't cheap. Fortunately, researchers have come up with a more affordable solution called a Corsi-Rosenthal box. Basically, it's a DIY air cleaner made up of a box fan and 4 or 5 MERV filters duct taped together. You can even find the instructions online. It's also pretty effective. A Corsi-Rosenthal box in a 200 square foot dorm room achieved the equivalent of about 24 air exchanges per hour, on par with a typical US hospital, and better than many similarly sized portable air cleaners. Number 4. Air disinfection. Finally, there's a method called air disinfection, which is basically inactivating viruses using ultraviolet light. Some systems work by shining a UV light across the top of a room, which neutralizes airborne pathogens as they circulate through that space. Some wavelengths of UV light are harmful to humans, although there is a wavelength called far UVC, which appears to be safer for people. This method is best for places such as hospitals or school cafeterias, rather than homes or small offices. Number 5. Investing in better air. The Biden administration recently called on building managers in schools, universities, and other settings to improve indoor air quality. Upgrading it can be expensive, but there are federal funds to support such efforts. Indoor air quality is important not just for reducing the rate of COVID transmission, but for our health in general.